Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So I took a knee to the head in a soccer game in September 2023. Thanks to you guys, I'm been fully recovered since May 2024 stuff. But I decided to go skiing for the first time on Sunday. And as you know about going skiing for the first time, you can fall a lot. I ended up falling twice. I fell a lot actually, but the second time that I fell, I hit my head. I was wearing a helmet. I had goggles on my helmet. And I sort of stopped the fall with my head because I've had that concussion before. I was really paranoid. I was like, shoot, I'm going to take a moment. I didn't feel right after I hit my head. But after eating some lunch and sitting down, I felt fine. And I ended up skiing the rest of the afternoon, which is pretty strenuous. So that was Sunday. On Monday and Tuesday, I worked from home because Seattle's been snowed in. And I felt completely fine. I walked to the grocery store, which is 25 minutes. That was fine. And then on Wednesday, I worked from home. And then after work, I went to the gym. And the lights were brighter than usual. And I was like, wow, did they make these lights brighter or something? The stimuli was really overwhelming. And when I went to warm up on the treadmill, I started feeling just awful. So I sat on a bench to calm down away from people. And then I tried to do abs and some exercise bike for 10 minutes until I just was feeling really terrible. I had a pretty nauseous walk home. And so basically by these symptoms, I'm maybe I had some sort of concussion, but, and even now I'm having these symptoms. And it was when I got home from the gym, it was hard to do basic tasks shower before bed. And I woke up this morning with headache, pain in my arms, kind of similar to when I first got concussed, but I felt fine Monday and Tuesday, and I'm super hesitant to jump to conclusions. And I know that it's really important to stay active and exercise and not sit in a dark room.
Mm-hmm.
And I'm kind of wondering, what is the best strategy? Should I start from the beginning? I've been in a really good bout of exercise. Obviously pushing myself in these exercises will make it worse. I can start at the baseline, getting my heart rate and stuff. Do you have any advice or feedback at this point?
Well, so, did you have another concussion? It's, you can't really know. I mean, the symptoms do fit, but the symptoms also fit with a bunch of other things. So it's hard to say, was it a concussion or was it not? Usually in these situations, we just say, treat it like it is, right? Treat it like it is, and that'll be your best bet. So, don't push yourself too hard at the gym. I think it's a good idea to kind of go back to kind of square one basics, work on, Melinda's modules, make sure your diet is good, kind of do all the foundational stuff that got you better in the first place. And, gradually increase your exercise, and you'll probably be feeling better fairly quickly because the earlier you start that stuff, the better. So don't push yourself too hard at the gym, because if there is a little bit of autonomic stuff, then you're just going to kind of hit that wall and start creating kind of setbacks for yourself. But if you just go, okay, I'm just going to go easy for a few days, I'm just going to gradually build my tolerance up again and those types of things, I think you'll be probably really surprised at how fast you can get better from this. Now, another thing, not to beat the neck thing to death, I feel like I'm always harping on neck because it's
Yeah.
one of those things that I feel that is just so commonly missed, is that generally with any type of injury, soft tissue injury, those types of things, even when you sprain your ankle,
Uh-huh.
it's you can kind of continue to play on it that day, but then it's like you wake up the next day and then it's starting to hurt more and more. And a few days later, it's even worse, right? And the same thing goes with kind of whiplash type injuries, right? Like it takes a while for like inflammation to kind of set in and now start to cause all these types of symptoms. So it's very also possible that when you fell, you kind of jammed your neck up a bit. That's going to make you feel off a little bit, but also just the anxiety response of that is also going to make you feel off. Like if you fall and you're like, oh shit, have I done it again? You're starting to kind of look at and analyzing everything. And then that can start to cause some of the same symptoms, but it also increases kind of stress and tension, in the neck. And then if there's been a bit of a neck issue, it might take a few days for those symptoms to evolve and start to actually come up. Right. So we see this all the time and people are like, oh, I felt fine for a few days. And then all of a sudden my symptoms started. I mean, neck is one of them, but it also could be that autonomic. It also could be like it could be a bunch of different things. So I would just say treat it like it's a concussion. That's your best bet, right? Take it easy for a bit, take frequent breaks when you're working, get up, walk around, go for some light exercise, work on the mindfulness stuff from Melinda's sections, make sure your diet is really good and clean, make sure you're getting good sleep at night, try to calm the nervous system down, all those types of things. I think that you'll be feeling better in no time. Get some neck work too.
I see, and, for sure, I think that there definitely was some whiplash with, like, the skiing. Even the afternoon when I continued to ski, I was still falling, but just not, like, hitting my head, just, like, being off balance. But my, one question is, I know you say that, like, getting or so right now I'm, like, over aggravated, like, my symptoms are, like, really aggravated, that's why it's, like, difficult, but I should continue to, like, walk those 20 minutes a day even if feeling bad as long like because sometimes there's that delayed reaction of when things will get worse. So I'm just trying to figure out, like, how much is too much. Like, if I'm having that, like, sensitivity to light, I'm, like, worried, like, maybe that's not the neck issue, but I guess, like, the
Can
general
be.
answer is just
It can be. One of the symptoms of neck dysfunction is increased sensitivity to light.
sure, okay, yeah, I think that makes me feel a lot better now because I don't think that hit to the head was so, like, the 70 Gs of force as you mentioned, so yeah, yeah, I think
Yeah.
that's everything. I know there's a lot of people in line, so I got the
But also like light sensitivity is an autonomic thing too.
mm,
Right? And inflammation and autonomic go hand in hand too. So it's kind of everything. It could be everything. So you just want to look at it holistically. Work on, calming the autonomic system down, doing nice diaphragmatic breathing exercises. If you're into meditation, you can start doing some of that. And and get your diet, clean again and all that good stuff. A little bit of light exercise, go out for just a 20-minute light exercise, like just walk around the block. And you may have some visual symptoms from that, especially if you have neck dysfunction or whatever, and that's okay. If 20 minutes is too much, then the next day drop it down to 10 and try that and see if that's okay. And find that kind of level that you can work at, and then just start building up from there according to symptom tolerance.
thank you, that's super helpful to inform my exercise plan, really appreciate it.
You're welcome. You'll be fine. You'll be fine.
Oh, oh, thanks.
Yeah, I agree. I agree with that, Cam. It sounds like it's neck. I'm sure Melinda probably is like it's an immediate like anxiety response, and because of the history, it's there's a lot of symptoms that you've described would fit with my patients with neck dysfunction. So
That's super great to
Yeah,
hear. Thank you.
I think it's really that mix of everything. And like Dr. Cam said, it can be really hard to pinpoint exactly what it is right now. But if you just kind of slow things down, and I just echo kind of what Dr. Cam said, take it easy and work on the things that supported you at the beginning,
hmm
and then reassess in a month, reassess in a little
yeah, and
while,
if
and
you
see
don't
how you're
get
doing.
improvement in a month, then that's where you reach out to the providers and start working with them, because there's lots of research showing that the sooner that you do get care in that kind of like 30-day period, if things are not moving in the right direction, because I think you have a well above average knowledge yourself because you've gone through the concussion fix
Sure.
program, so you don't need to jump to that right away because you have a lot of those tools.
Hmm.
But then if you feel like, okay, things are not really going the way that I want to in the next 2 weeks, get in and start working with, again, we suspect it's the neck, and start working on that.
Sure. Thank you so much. This is
Mhm.
really helpful.
Yeah, that first setback or that first kind of flare after you've recovered or feel like you're kind of back to yourself again can be really upsetting and bring on a lot of anxiety. So it's sort of that first time you've had one of those setbacks. And I know we've heard from a lot of members here that, once they get through that hurdle of having that first setback and they realize it only takes a little while to kind of get things back to baseline or their new baseline following the first concussion, then you can build that confidence that, hey, if I, decide to go skiing and something happens, I feel more confident that I'll recover in the way I need to if something does happen. So it can be kind of, destabilizing thinking about having that first setback following the recovery. But, once you kind of move through this, hopefully you'll be able to find a little bit more confidence in recovering from small setbacks.
Right, that makes sense.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.